Let us discuss what options do we have. We want to avoid surgery deep endometriosis patients. So the options what we generally look at is a medical treatment. So let us discuss the medical treatment. What medical treatment options do we have when we want to postpone the surgery or not have a surgery immediately? The medical treatments generally comes in hormonal and non-hormonal parts. The non-hormonal parts are painkillers and anti-inflammatory medications, which are normal NSAIDs like ibuprofen, diclofenac, and all these anti-inflammatory drugs. And then comes the second type of treatment is hormonal treatment. The hormonal treatment basically has four main type of hormonal treatments which we can discuss. First is a combined oral contraceptive pills which has a estrogen and progesterone, but it is taken in non-cyclical way. Like you don't the birth control pills normally are prescribed for 21 days and there is a 7-day gap and again 21 days, so that irregular cycles are coming in endometriosis patients. What we like to do is continuously for 3 to 4 strips like 63 or 84 days we don't stop the tablet so that the periods are stopped. So the non-cyclical administration of oral contraceptives or birth control pills is option number one. It is a preferred option for young girls who are diagnosed with endometriosis and then they don't have a lot of estrogen deprivation symptoms because of starting this. Second option comes is only progesterone treatment. The progesterone hormone is a treatment for endometriosis which will shrink the implants and prevent the recurrence and not let the endometriosis grow inside. So the only progesterone drugs which like Dynogest are given for continuous fashion. They are not given for continuous for 6 months, 8 months and or a year with the proper monitoring. So that is the second form of treatment. Third form of treatment which comes is a intrauterine device like a Marina coil, where the advantage is it will be inserted inside the uterus. You don't have to daily take tablets, which is very uncomfortable for many of the patients, plus the side effects which we will discuss with the tablets. And then on the Marina coil, the life is 5 years and we don't have to take tablets, stop the periods eventually and cause amenorrhea, which will not the endometriosis grow. So it's also a hormonal intrauterine device. The hormone again is the progesterone hormone, levonorgestrone hormone. So these are the three types. The fourth most important treatment is GnRH analog like leuprolide injections. These are strong medications which will cause post-menopausal state and shrink the implants, shrink the size of adenomyosis, shrink the endometriosis. So these injections are generally not given more than 3 months to 6 months because they parallelly cause bone loss. The bone density has to be monitored, and second thing is you can't give it for a long time. The reason being it will cause bone loss and estrogen deprived severe postmenopausal symptoms. So these are, but then there are specific indications like you want to shrink the adenomyosis before having a pregnancy or very severe disease and micro implants you want to shrink with this. For when a person wants to go for a pregnancy treatment, that time it is important that you can use this particular modality. Then there are various drugs like aromatase inhibitors, GnRH antagonists, some oral tablets. But then if you see overall, these are the four main modalities of treatment. Should we take medical treatment for a long time and avoid surgery? That is a different discussion altogether. We advise the use of medical treatment only for protecting the fertility potential and avoiding the recurrence. But a good excisional surgery with very less residual disease has a option of not taking medical treatment and keeping a regular follow-up only. Plus, when you are on medical treatment, you should monitor your first three types of medical treatment which we discussed, like control pill, only progesterone treatment, and the Marina coil. We should monitor your liver function, lipid profile, blood pressure, and a yearly mammography. So these are the particular monitoring charts. And in addition, we monitor the bone density if you are taking a treatment of GnRH analog. So this is about the medical treatment. So medical treatment should be very judiciously used and it has to be used for short time. Prolonged use of medical treatment to avoid surgery makes the eventual surgery difficult. That is an important point to remember. Thank you.